It's a cancer of neoplasm of the B cells. Now, where from these B cells are coming from? Okay, so if you say in the bone marrow, we know there is a stem cells, right? So from the stem cells, there are two chains. You can say two chains. If you see, this is in the bone marrow. There is our hemopoietic stem cells. They've got two dynasties. You can say they have two chains. One is called Lymphoid Series. Another is called Myeloid Series. Now, when you say Myeloid Series, they are the platelets, they are the WBCs, all the white blood cells except lymphocytes, like granulocytes, neutrophils, eosinophils, basophils, then monocytes. Okay, so you can say leukocytes or the WBCs except lymphocytes. So they form in the Myeloid series. They are the environmentally they are the oldest one, and they are surviving. They are giving us innate immunity. Coming to the lymphoid series. So these lymphoid series are either T lymphocytes or B lymphocytes. Now, major difference between the lymphoid series and myeloid series is that lymphoid series don't mature there. Okay, they has to send for a distant area, like you go for graduation or for further studies, you go to a different university. Same way, once they are developed in the bone marrow, these B lymphocytes or T lymphocytes, they go for maturation, the proper maturations. Okay, they go for proper maturations to where they go for the lymphoid organs, like lymph nodes and spleen. So they travel by the blood, and in the spleen and the lymph nodes they only mature. This is the main difference between this myeloid series and lymphocyte series. So myeloid series, they mature here and then they are spilled into the blood. While if we talk about B lymphocytes or T lymphocytes, so what they do, they are traveling from once they are developed properly in the bone marrow. Okay, so they go to distant organs like lymph nodes and spleen, where they are time to time they are exposed to antigens. Because let's say B lymphocytes, so once they are developed in the bone marrow. Now, what is bone marrow? Sometimes question asked to the year 1 or year 2, what is bone marrow? Bone marrow is the deepest core of the bone, consisting of stroma, tissue, and spongy. It's a spongy thing, a semi-solid state. So from the bone marrow, it is through the blood, it goes to the spleen. Okay, the B lymphocytes. So like you are going for a graduation in the higher university. So once they come into the spleen, now we know spleen is exposed, is connected to the lymph. So this lymph is carrying antigens. So once these antigens, they are constantly coming to the spleen. So they are here, so when these B lymphocytes are time to time being exposed to the antigens, they are matured. So the difference is that these B lymphocytes, they need to travel to the spleen and the lymph nodes and get matured in the final stages. Now, once they are exposed to antigens, these B lymphocytes will develop into plasma cells. These plasma cells secretes antibodies. Now we know antibodies are made of light chain and heavy chains. So that is the rule. So once B cells, they develop in the bone marrow from the stem cells, okay, and they travel to the spleen. In the spleen, they are time to time exposed to the antigens, and when they are exposed to antigens, means any mature B lymphocyte, which we can also call as naive B lymphocytes, they are matured. But then when they are exposed to antigens, they develop into plasma cells, and then these plasma cells, they throw plenty of antibodies. What they throw plenty of antibodies. So, and giving us humoral immunity. So myeloid lymphoid series, they are part of our adaptive immune system. Adaptive immune system. So this is the main difference between lymphoid series and myeloid series. Now, when there is, now sometimes these B lymphocytes may, they may diagnose or they may act on self antigens, what we call as autoimmune disorder. Okay, what we call as autoimmune disorder. Now sometimes it asks in MCQs what are the autoimmune disorders related to the B cells. So we have got one mnemonic we call SMS the doctor. Whenever you have a problem, SMS the doctor. So what are the things here? So S for scleroderma, M for multiple sclerosis, S for SLE, then D for type 1 diabetes type 1, R for rheumatic arthritis or rheumatoid arthritis. So these are autoimmune disorder related to B cell. Okay, most often comes the questions. So all these are related to B cells except. So you have to find this. So scleroderma, multiple sclerosis, SLE, diabetes, rheumatoid arthritis are when there is a autoimmune disorder related to the B cells. We are talking about B cells coming from the bone marrow, going to the spleen and maturing. Okay. Then when there is a problem in the plasma cells, suppose there is a neoplasm in the plasma cells. Okay. So when there is a problem in the plasma cells or when there is a cancer of this plasma cells, then we call it the multiple myeloma. Now when there is enormous multiplication of these plasma cells, when there is abnormal plasma cells, they are multiplying. Okay, what will happen when there is abnormal multiple enormous neoplasm? We know what a cancer cells. When these plasma cells are abnormally multiplying, let's say, so they can form a tumor. They can form a mass-like thing. So when there is one, we call this plasma cytoma. And when there is plenty plasma cytoma, when there is plenty growth of plasma cells, plenty balls of plasma cells, then we call that a multiple myeloma because it's multiple. So this is the concept. So myeloma means, myeloma, what is myeloma? It is a B cell neoplasm. Okay. So when there is a problem in the plasma cells, then there is a multiple myeloma develops. Okay. Which is very commonly associated with amyloidosis, and there is Waldenstrom's. And when there is cancer of the B cells, now when these B cells, when there is a B cell, when these B cells are having cancer and malignancy in B cells, then they can develop into like CLL, chronic lymphocytic leukemia, ALL, all these, then hairy cell leukemia. All these are B cells, neoplasm. So we have to differentiate like this. So what are plasma cells, neoplasm? Multiple myeloma. What are B cell neoplasm? CLL, ALL, hairy cell leukemia. And what are autoimmune disorder related to the B cell? They are SMS to your doctor whenever you are in trouble. Scleroderma, multiple sclerosis, SLE, diabetes, and rheumatic arthritis. Okay, so these are related to these are the basics. When you go to understand the multiple myeloma, first you have to clear the basics that it is a tumor of plasma cells, not a B cell. It is a tumor of plasma cell. Okay, and forming multiple myeloma. Okay, now we are going to understand the pathophysiology of multiple myeloma. So pathophysiology. So when you get, now first of all let me tell you, there is no proper etiology of multiple myeloma. But yes, there are relations to infections like Epstein-Barr virus, then Kaposi sarcoma virus, what we can say, like human herpes virus 8. Okay, they have some relation. Sometimes they go in parallel, but there is no particular evidence that this can cause plasma cell myeloma or multiple myeloma. There is connection to obesity. High BMI is seen mostly in cases of plasma cell myeloma or multiple myeloma, and there is exposure to radiations. Exposure to radiations is also commonly seen in association with multiple myeloma. So, what are the things that develops? Now, when this plasma cells which is throwing out normally antibodies, okay, and when there is a neoplasm in plasma cells, now what will happen? Will these antibodies be normal? No, there will be abnormal antibodies. You can say these antibodies which are formed of heavy chain and light chains. They spill now if there is any neoplasm, or you can say multiple myeloma or plasma cell myeloma. What happens? There will be fragments of antibodies. Fragments of antibodies are seen in the blood. Fragments of antibodies. Now we know antibodies are made of light chain and heavy chain. So in multiple myeloma, we will mostly see light chains, which you have to remember. There will be overexpression of light chains. So enormous amount of light chains found in the blood, which can cause viscosity and many other problems. Can cause kidney disorders like nephropathy and organ damage. Okay. So now we go to the pathophysiology. So when you have to understand the multiple myeloma pathology, you have to know that the basic importance of multiple myeloma, the basic thing in multiple myeloma that you need to understand, okay, because it is very difficult to cure the disease. There is treatment, but it's very difficult because in multiple myeloma, the plasma cells, they secure their environment. They have some survival factors. They secrete some survival factors. They secrete their own growth factors, due to which they have enormous resistance to anti-cancer drugs. Okay, like very commonly interleukin 6, interleukin 8. Okay, they act as their growth promoting factor, and they also act as a survival factors. So, in cases of multiple myeloma, there is first thing is that you have to understand the survival factor. They have survival factors, which gives them a secure environment in the bone marrow, which protects them from the anti-cancer drugs. Next thing is that we know there is the tumor cells, they grow into a tumor. So because of the growing size of the tumor, there will be tumor mass effect. Tumor mass effect, which can lead to cord compression. So when this thing is growing in the bone marrow, obviously it will compress the spinal cord. So cord compression. So this is because of the cord compression. There's a variety of things coming up, like carpal tunnel syndrome develop. Carpal tunnel syndrome. There will be pain because of the peripheral neuropathy. Nerves will be compressed. It will cause pain. So all these are because of the mass effect. It's the growing size, tumor mass effect. Then there can be these myeloma cells. Remember, they produce lots of interleukins and cytokines. So the production of these cytokines and chemokines, it will cause obviously anemia. Okay, it can cause anemia because there is now what happens? Okay, I'll come to the details. What happens in anemia? We know there is red blood cells are decreased. The whole erythropoiesis is negatively impacted by this growth of plasma cells because of some death signals. Okay. Apart from that, what happens in multiple myeloma is there is bone destruction. Bone destruction. Now there is enormous bone destructions. Enormous bone destructions, you can say. Enormous bone destruction. We know in the bone there is a balance between osteolysis and osteoblast. Osteoclast and osteoblast. Okay, so here there is overexpression of osteoclast cells. Okay, there is overexpression of osteoclast cells. Osteoclast cells. Due to overexpression of another thing which comes in MCQs, Rankel. which are receptor activator nuclear factor K ligand. Okay, so receptor activator and for nuclear factor K ligand. So because of this radical, there are overexpression of osteoclast, means bone resorption is more than the bone production. So bone becomes weak. Okay, and as a result, there will be pathological fracture or vulnerable to fracture. Often there is when the X-ray of the skull is done in multiple myeloma, it gives a raindrop appearance, which also comes as one mark question in as the MCQs. Raindrop appearance in X-ray skull in multiple myeloma. So there is bone resorption, bone damage. There is some survival factors as a result, resistant to anti-cancer drugs. There it can be tumor mass effects, and because of the cytokines which can produce anoxia, thrombosis, there is a anemia. Also because of some death signals coming from the developing plasma cells, growth of the plasma cells. Along with that, what happens? Now you have to notice that here in the whole scenario, we have known that these plasma cells produce abnormal immunoglobulins. So these plasma cells, they are not producing normal antibodies, they are producing abnormal immunoglobulins. So abnormal immunoglobulins means our immune system is affected. Our immune system goes down. So there is as a result there is high chance of developing infection due to Staphylo, E. coli. These are very commonly associated infections, okay, leading to pneumonia in multiple myeloma case. This is also one factor. So another factor is that it is not common, not uncommon, very common is nephropathy, kidney damage. Now, how the kidneys are damaged? Remember how the kidneys are damaged. So what happens in the bone? In the bones there are bone destruction. So this, when there is bone destruction, there will be enormous amount of calcium ions in the blood. So there is hypercalcemia. So now these calciums are going into the kidneys. These calciums are going into the kidneys. So kidneys are stressed with overloading of hypercalcemia. As a result, there is hypercalciuria also. Another thing, what is happening in the blood vessels, there is abnormal immunoglobulins. We call it light chains. Okay, so light chains proteins. Now these light chains finally in the blood, they will go where? They will go to the kidneys. Now if you remember the nephron, it is a simple nephron, and this is glomerulus. So now more and more, basically there is excess or overexpression of light chains. So let's say these are the light chains proteins. So these light chain proteins, they do escape through the nephron, through the glomerular membrane, and they are absorbed, reabsorbed usually. So the problem in the kidney starts when this absorption capacity is exhausted, when this reabsorption of the light chains is exhausted. So as a result, what will happen? Now light chains are being deposited, so it's forming light chain cast. Light chain cast. When there is no more absorption can be done, so light chain cast is formed, which can produce interstitial nephropathy. Interstitial nephropathy. Another factor that very commonly associated with multiple myeloma is there is amyloid deposits. So when there is plenty of amyloid deposits along with the light chain proteins, then it can cause proteinuria and can cause nephrotic syndrome also. So kidneys are very commonly damaged in cases of multiple myeloma because of exhaustion of the absorption capacity of the tubules, plus there is calcium which can cause calcium overloading here, hypercalcemia like conditions, calciuria like conditions. It can cause pre-renal azotemia also. So overall kidneys are damaged. So what are the things, let me recap what are the things that is going in multiple myeloma. Okay, before going to the end, you must know that there is also bleeding disorders. Very commonly it is asked in Viva, why there is a bleeding disorder, and students most commonly they answer that it is because of low platelet count, because we know there is plasma cells are overdeveloping, overexpressing, so it affect the erythropoiesis. So in the same way it also affect the platelet count, but the answer is no. Platelet count is usually not affected. It can be affected only in the late stage, because the whole scenario in the multiple myeloma, they don't have any thrombopenic effect. So platelets are not affected. Then how come there is a bleeding disorder? Bleeding disorder is because there is associated acquired coagulopathy. There is factor 10 which can goes down. There is perivascular amyloidosis. Perivascular amyloidosis can be formed. Can be anoxia, and there is coagulopathy can develop. So because of these factors, there can be bleeding disorders, but it is not because of low platelet count, which you must remember. The bleeding disorders found in the plasma cell myeloma or multiple myeloma is not because of platelet count, low platelet count. Another thing is very also not so commonly affected, but the movement of the mouth, movement of the jaws, they are also very much affected in multiple myeloma or plasma cell myeloma. So what are the things now that you need to know? Another thing, and the last thing, okay, is hyperviscosity. So because of hyperviscosity, there is many end organ problems. Okay, hyperviscosity. Why there is hyperviscosity? Because of abnormal presence of myeloma or plasma cells, right? So it can cause many other defects. And you know, when the viscosity of the blood is increased, so blood will travel at a lower speed. Very commonly it can cause retinopathy, which is very quick to get affected whenever there is hyperviscosity in the blood. It can cause retinopathy, it can cause blindness. So when we see when you see multiple myeloma, you have to understand that it can be, so like as I told you in pathophysiology, tumor mass effect, which can lead to cord compression, and this is the thing that is leading to all the sort of bone pain, which is very commonly bone pain. So the bone pain is because of the compression of the nerves, okay, like peripheral neuropathy kind of symptoms. It can be because of the osteolytic fractures of the bones, vertebral compressions, okay, and this is one of the thing that the multiple myeloma patients usually present before getting diagnosed. They usually present with bone pain, okay. So anemia is the thing that we discussed because of cytokines and chemokines. Then nephropathy, infections, mouth lesions, difficulty in movement of the mouth, bleeding disorders, hyperviscosity syndrome, viscosity syndromes, peripheral neuropathy, so these are the basic pathophysiology or clinical features of plasma cell myeloma or multiple myeloma. So you have to remember all these 8 points related to the multiple myeloma. So